Association indicate nearly 4,000 nurses left the country and immigrated to the West in 2022, pegging the current immigration rate at about 500 nurses every month. This is alarming, and if you're struggling to understand why, this is a bit of a background to refresh your mind. So just recently, we've seen from September 8, 2023, and this is from the Ministry of Health. It says 2,000 nurses are seeking greener pastures abroad. And then by October 5, 2023, it jumps from 2,000 to 10,000 teachers relocating to the UK, and this is also coming from the National Teaching Council. So why are they leaving? These are a few of the complaints they've been making: low salaries, poor infrastructure, delayed promotion, rising cost of living, economic hardship. But then there's also the bigger issue that we need to look at, because this is the description that has been given by the Ghana Registered Nurses and Midwives Association. It says that the nurses that are seeking clearance to leave Ghana for greener pastures, that is in 2023, between January and July 2023, 10,209. The number of nurses who have been cleared already to leave is 4,000, which stands at 39.2%. But remember, if the attrition rate is 500 a month, your calculation within 12 months, which is 1 year, gives you 6,000. So it's obvious that this year the number would even increase from 4,000 to 6,000. So an old problem. That's a question we're asking. Is this an old problem? First, 2023, an estimated 33,185 teachers abandoned their posts to seek greener pastures elsewhere. That's coming from NAT. In 2022, 59.9% of practicing nurses intend to leave the country, and that's coming from a survey. And I mean, this is Dr. Pakwesi Bedu. And he's a typical example of what we've been talking about. He's the Ashanti Regional President of the Ghana Medical Association. In June 2022, this is what he said: about 10,727 nurses have been at home and unable to find employment since 2019. Now he goes on to say, I was earning more washing cars in the UK than at home. So I was making more than £2,000 a month, whereas my salary here in Ghana is not even up to $1,000. This is a cause for concern. And if you were in his shoes, I'm sure you'll be thinking the same. According to the Ghana Statistical Service, over 80% of public sector workers earn less than 3,000 Ghana cedis, and only 20% earn 3,000 cedis or more. Health workers. So this is the daily minimum wage and the annual adjustment, and it's on year. From 2014 and then between 2013, 2014, look at it, it was 14.5%, then up to 16.9%. Then fast forward to 2017, and the adjustment is still 16.66%. I mean, the difference is just a little. 2017, now it's down to 14.28%. 2018, 10%. 2019, 10.43%. Then 2021, 10.57%, a difference of 6%. 2022 and 2023, there you have it, 10%, a reduction of 7.9%. This could be the reason they're asking for, they're all leaving the country. And tonight we want to look at exactly what the problem is. It's only when we know the problem, then we can proffer solutions. Now, joining me for the discussion tonight is Reverend Isaac Owusu, President, Ghana Association of Teachers. Perpetual Oforiampofo is President of the Registered Nurses and Midwives Association. Kwame Sapon Asiedo is Pharmacist and CDD Fellow in Health. and Dr. Peter Anti is Executive Director of the Institute of Education. Let's have a conversation after this break.
Your calendar for our annual alumni homecoming and the grand celebration of UPSA's 58th anniversary as we gather under the theme, The Global Impact of Professionals in Business. Program lineup for the celebration are as follows. Friday, 27th October 2023, ignite the night with a bonfire and drama performances with old school dressing, variety of entertainment at 7 p.m. Saturday, 28th October, get your adrenaline pumping with alumni fun games. Current students will contribute to a noble cause with blood donation starting at 7 a.m. Tuesday, 31st October, mentorship sessions at 2 p.m. All activities will take place right on the UPSA campus where it all began. For more information, visit our website at www.upsaglobalalumni.com or contact the UPSA Alumni Office on 0243-288-579 or Room 19 Central Administration. UPSA, scholarship with professionalism.
About 1/3 of a million people live with HIV in Ghana. Close to 10,000 of them die each year, mostly as a result of a lack of antiretroviral drugs and adherence. In fact, close to 57% of children under 14 years living with HIV do not receive antiretroviral drugs, again as a result of inadequate funds to provide them with medication.
Life expectancy for these children is grim. The big worry, close to 16,300 people are newly infected with HIV each year. With this alarming rate of HIV infections, all of us are in danger, and Ghana is headed for an epidemic explosion if nothing is done now to avert it. While the Ghana AIDS Commission is working hard to overturn the situation, the Commission urgently needs funding support from corporate Ghana and individuals to save lives. We're therefore appealing to you, corporate entities and individuals, to support the National HIV and AIDS Fund by dialing *9898# on MTN and Vodafone and follow the prompts, or pay into the National HIV and AIDS Fund account number 101-863-161-3233, Bank of Ghana. Your donation will be used to prevent new infections and provide care for people living with HIV, including children affected by AIDS. For further information, please call Ghana AIDS Commission on 0302 919260 or email info@ghanaids.gov.gh. Give to save a life today. Ghana AIDS Commission, partnering to eliminate HIV and AIDS.
Daddy, this tank is big.
Yes, that's true.
It can store a lot of water.
That's so true.
Wow, it has a working tortoise on it.
That's so true.
I can see SINTEX. Syntax.
That is so true, my daughter.
When it falls down, it will spoil.
That's not true.
But why?
Hey! Syntex was the first to introduce double-layer tanks in Ghana. Syntex again was the first to introduce white inner layers in Ghana. Syntex gives you the biggest warranty, 7 years. No matter your water needs, Syntex is the answer. Syntex tank. Are you strong? Are you tough?
Can he tee up someone in red? It goes to one!
That's who goal is for. After 5 Champions League, you want to know? I be the real goal. Tell me. I'm the real goal. The left magician.
Who is the goat? Ghana Jollof or Nigerian Jollof?
Ghana Jollof has no co-equal. The smell alone. Oh my God.
No, that shift. You two they lie. Now the same stew when they use cook the rice and then they go put them for top.
You are lying. Ghana Jollof.
Zara. Are you busy? Forget everybody. Yeah. My guy. Put some respect on the goat. On the goat? The only goat I know lives in Tama. Every year, we dey give to you back to back. We are talking about PET. I want some Yadiaji face. Except be the goat, huh? My guy, he be the goat.
Though our choice of goats may differ in football, music, and jollof, Alomo Bitters always brings us together. Alomo, experience greatness in every moment.
Drink responsibly. Not for sale to persons under 18 or recommended to pregnant women. This advert is FDA approved.
Hello, my name is Abeku Agri Santana. If there's anything that makes my life so easy, it is my bank. I love hanging out with my boys at our usual fufu joint. But even without cash, we still dey chop better with EcoBank Mobile. No matter the time of day, my bank helps me stay in touch with my beautiful wife whenever she's away. And when my beautiful wife is in town, she never misses out on her favorite TV shows because I'm able to pay up all my TV subscriptions from the comfort of my mobile phone. Whenever she has to get groceries too, my bank makes it cashless and convenient. And the part my wife loves the most is when my bank makes it possible and easy for her to shop from any part of the world without moving.
Welcome to the smart world of EcoBank. Download EcoBank Mobile from Google Play Store or the App Store and discover the smart way to bank. EcoBank, the Pan-African Bank.
Welcome back to PM Express. My name is Aisha Ibrahim. Many thanks for choosing us. We're sponsored by Syntex Tanks. It is strong, it is tough. Alomo Bitters, experience greatness in every moment, and the Ghana AIDS Commission. So no matter your water needs, Syntex Tank has it all. Syntex Tank is the first to introduce double layer tank, and now you can have as many layers as you want. Syntex Tank is first to introduce white inner layer tanks in Ghana. We now introduce to you the customer specs order, which lets you order any color and size of preference. Syntex tank gives you the longest warranty of 7 years, which no other tank gives you in Ghana. So whatever your water consumption, size of projects or demand, choose Syntex tank. We have agents nationwide. You can call Syntex on 0244 335 168 or shop online at syntexgh.com. Syntex tank, a year strong, a year tough. I want to welcome all of you, gentlemen and lady, on the show. Of course, I think that we need to understand the issues affecting these professionals, the reason they're taking that decision. That way, it becomes easy to diagnose solutions. And then, I would like to start with you, the teachers. Reverend, what are your people telling you?
Well, Aisha, good evening.
Good evening, Reverend. Go ahead.
Yes. I think, let me say very good evening to your cherished viewers, and also good evening to my colleague panel members on the show. The main reason for the experienced teachers leaving the country is very simple. And it's about their poor condition of service. That is the main reason why the experienced teachers are leaving the country, Aisha.
Okay, poor condition of service. What would you have? Because I know over the period, government has been trying to solve some of the problems affecting you. Recently, you demanded for COLA, and then even in the budget, government tried to make some adjustments for teachers. What would you have government do in the circumstance that we find ourselves as a country?
Well, I think, you see, the COLA, as you made reference of, is for all public sector workers. But when you come to the teachers in respective, successive governments, yes, have made attempts. But the politicians, the successive government, they all have admitted that in Ghana, teachers are poorly paid. And you see, if somebody is employed to serve the country and work for close to 30 years, and the person is given 10,000 as pension gratuity, certainly if a colleague hears that if you are able to go to Canada, or you go to maybe UK, or you go to US or South Africa, and you can make it there, certainly the teacher will leave. You see, the successive government always claim that teachers are too many in the country, and sometimes when we hear some of these comments, we laugh. Aisha, the average teacher receives about 1,800 Ghana cedis a month. A degree holder, about 1,800 cedis a month. That is the take-home salary that the teachers take. And there is nothing like accommodation to help this teacher. There is nothing like a mutual health scheme in terms of sickness. You see, those working at the basic school, if you look at the working environment, those working on the island, last year we lost a young teacher in Kachi West. He went for his...
What shall we do with the broke propeller? What shall we do with the broke propeller? Don't look at me, I wasn't driving. Thank you, you're not helping. I don't even know why you bought this boat. You told me that you loved this boat. That was before you wrecked the boat. Well, now you've made it awkward.
Accidents don't just happen in sea shanties, so Progressive Boat Insurance has you covered. Take as little as 4 minutes to see what you can save at Progressive.com. Progressive Casualty Insurance Company and affiliates. Covered subject to policy terms and not available for all boats or in all situations.
Salary, and on his way back, the boat that they were using subsided, and we lost this teacher painfully. So, with some of these factors, it's as a result why the teachers are living day in, day out.
Well, Perpetual, your case is even worse, with about 500 nurses, leaving every month. What are you picking from your people? Kindly unmute for me, Perpetual.
Right. Very well. Can you hear me now?
Great. Go ahead.
Okay. So good evening to you, good evening to your viewers, and good evening to your panelists. We have been talking about these things or this issue over and over again, but the more we talk about it, the more it brings credence to the fact that this is a national issue that we need to discuss thoroughly and find solutions to. So when it comes to our nurses and midwives, the first reason why they would want to leave is the fact that salaries are poor, conditions of service are not the best. When it comes to the work environment, it's very difficult. My colleague was talking about the terrain in which some teachers work. When it comes to nurses and midwives, sometimes it is worse. Some have to cross rivers, serving in underserved, underprivileged, deprived areas, typical rural areas. And without them being there, the community cannot have access to any kind of help. So the conditions under which they work, the limited opportunities for career development and for academic progression, low levels of resources to work with in terms of equipment and medications and everything that there is to in terms of our practice. We also don't have very kind policies related to work-life balance, where the work and your personal life should actually sync so that you can have a peaceful mind to do your work. We don't have that too often. And of course, the unemployment issue, as we speak now, we have the 2021 and 2022 batches that are waiting to be employed. And we are talking about thousands of nurses and midwives, both auxiliary, diploma, and then degree holders. And when you look at what the Nursing and Midwifery Council had, the data that it has churned out, all over the country, we have about 133 nursing and midwifery schools, both in the public and private sector. And year in, year out, we are training thousands of nurses and midwives. Currently, on their system, they have about 85,055 professional nurses, and we have about 51,733 thereabouts as auxiliary nurses. So altogether, we are talking about 136,773 nurses and midwives, serving a population of about 34 million. It is absolutely not the best, more so when you look at the inequitable distribution of our nurses across the country. And they are leaving because of these reasons that I have mentioned, and it's important that we address the issues and begin to implement realistic solutions that will attract and retain them in this country. Because the more they leave, we shouldn't take it for granted that we train thousands of them, so when some are leaving, it's okay. No, it affects the healthcare system in terms of the quality and the safety of services that we can give to the Ghanaian people.
I agree, and in as much as we want the conditions of health workers, nurses to improve, I mean, these health workers have sworn oath to actually save lives. You are not bothered that your absence, or I mean, the attrition rate would actually lead to more deaths and, you know, putting vulnerable people in very tight situations?
No, I think you are wrong. It is true that we have sworn an oath to give the best of care to the patients that we take care of. It is enshrined in our standards, in our ethics, in everything. But we have never sworn an oath to also deprive ourselves of the quality of decent work and conditions of service that will make our lives better. We have never done that. And it's important that government of the day and governments that will come have to take things seriously. I don't know whether you want me to begin to talk about the solutions to some of the issues that we have already, because we need to take them one after the other and address them. And in fact, we have the capacity to look at some of them immediately and look at how we can resolve the issues of other conditions of service. Of course, we know what we want as nurses and midwives, and we also understand the fiscal challenge that the government of the day finds itself. We are currently at the IMF, but the economy is still running. People must still wake up, work, and eat, and take care of their families. So we must be able to manage the system such that we should be able to take care of our workers. It is not the best that we have our professionals whom we have used the taxpayers' money to train, such that during their training, they did not pay full school fees. It was highly subsidized. And it was your tax, my tax, that trained them. And we can't sit aloof and have them all leave. And we have agencies in this country that are picking or recruiting our nurses and midwives. We have governments that are hiding behind the scenes and poaching them and taking them away under the disguise of, it is their personal decisions, it is their will to leave. But at the end of the day, we must look at it as a country. Are we going to be able to achieve the specific targets of SDG 3 and actually make the system such that we can attain universal health coverage as well? It looks like all these things are not going to be attainable by the year 2030. And the fact that you and I have taken the decision to live here, to live in Ghana, we deserve as citizens to have quality public services, including health, including education, including transport, and everything else. And it's important that government takes these things seriously and look at them.
Mr. Seydou Sapon, last year alone, 4,000 nurses left the country and actually migrated to the West. Statistics suggest it will be more this year because if you do the calculation, 500 a month by 12 gives you 6,000 annually. You have been very consistent in your effort to get government to sit up, especially in the health sector. And now this. How dangerous is this situation?
Well, yes, consistency comes at a cost. Any society that wants to seriously develop must be purposeful, first and foremost, and intentional. I've listened to the nurses, I've listened to the teachers, and one thing runs through. As a society, we are not purposeful in ensuring that we develop the next generation. And why do I say that? You need the teachers to teach, to be able to train the nurses. Because the teachers start teaching right from kindergarten all through to be able to train the nurses, to train the doctors, to train pharmacists like myself, and then for some of us to then go to graduate schools to get to the level that fortunately I've had to get to. To do so, you also need the taxpayers' money because the taxpayer is the one who's going to input into the basket for you to do these trainings. So you need to have a clear plan in place. The truth of the matter is we've been very ad hoc when it comes to education and when it comes to health. And why do I say that? I'll give you typical examples. You just heard the president of the Nurses and Midwifery Association say they've got nurses from 2021 and 2022, and there are thousands who need to be employed. These are nurses that we have paid training allowances to whilst they were in school. You also heard us say that it is not as easy as saying that if the nurses leave because you have a backfill, because there are so many sitting at home, you can just fill because they leave with expertise and skills, which the people sitting at home do not have. More importantly, they would have suffered attrition because they have theoretical knowledge, but their practical knowledge hasn't been harnessed because they've had to sit at home whilst clearance is being sought. So you ask yourself the question, was paying their allowances while in school necessary? I can understand, and I've been an advocate for that in saying that if you need that human resource, because if you look at our nurse to population ratio, the governments and our politicians would always argue, oh, we meet the WHO standards, but that's incorrect. Because when you disaggregate from the auxiliary nurses to professional nurses and all that, you realize that we fall short. So I can understand that you prioritize them and pay them allowances because you want to train them. But if you train them and you don't have the fiscal space to employ them, then the question becomes, are you becoming a drain on the economy by virtue of paying that money when you do not have a stream to employ them? And the answer is this. It's because we've not been purposeful. We've not been purposeful because the decision to pay those allowances was a political one, not a health decision. It was because the sitting president then said it can't be paid because we don't have the fiscal space. And the person wanting to succeed him in opposition said, no, we have to pay it because we need these nurses. What the person in opposition didn't realize was that if you pay them, you've got to employ them. And he had no plan to employ them. So 7 years down the line, having been in power, we cannot employ them. And we have our best nurses leaving. And we cannot backfill them as quickly as possible. Not just because we cannot employ, but because we cannot backfill the skills. So to answer your question, I would say that the only way we're going to get this right is for us to have an honest conversation about where we sit when it comes to our health human resource and our educational human resource. I heard the Minister of Education last week say what we have is not a shortage of teachers, but a distribution problem. And I laughed. I laughed because I, by virtue of what I do professionally, have access to the recruitment strategies of countries in the West. They don't recruit teachers or nurses who just qualified and left the classroom yesterday. For most of them, there's a minimum of 3 years. So if they are coming to recruit your teachers after 3 years, when they've gone through the canoe boat, some of them unfortunately have lost their lives, like you heard the president of the teachers saying, and have gotten the skills and then suddenly leave. That is a leech on your economy, because those people are not going to train the students who become the teachers, who become the nurses, who become the doctors. So if you have a policymaker sitting and then making a statement like that, you know we are not purposeful enough. All he's looking at is the global statistic of we have this so number of teachers that we are training and we are bringing out, and we can employ them. They just don't want to go to the rural areas. He's not looking at the loss of quality in the training process of our human resource across our economy. And that is why we've got here.
Those are very interesting, analysis you've been able to put together. Dr. Peter Anti, I am aware, of course, and Mr. Asiedu Sapon also alluded to that fact that, we know that there are challenges affecting teachers. In fact, Reverend also mentioned a few of them. But what I see is a conscious effort by government to deal with some of these problems. Are the teachers asking for too much?
No, I don't think the teachers are asking for too much. Good evening to your viewers and listeners, and good evening to my fellow panelists. I don't think the teachers are asking for too much. You see, I have said that if you look at the problems that the teacher faces, it is compounded with poor resources for carrying out their duties, and then the issue of poor conditions of service. The biggest one, of course, Reverend mentioned it, which is the finance issue. But if you are not being paid well, and then you go to school, and when it is raining, you have to go and hide under a tree. If you are not being paid well, and when you try to pick your book from your drawer in the staff common room, you are met with a snake. If you are not being paid well, and when you are going to school, there's a likelihood that you would lose your life because you don't have life jacket. That is more serious than just looking at the situation or the issue from the financial aspect. You are not being paid well. You get to the classroom, you have about 80 students that you are supposed to deal with. You give exercise to them and you are supposed to mark all these scripts. You are not being paid well, and in that classroom, you don't even have a staff. In that school, you don't even have a staff common room that you will sit. You are not being paid well. You don't have chalk. Your board is something else. You don't have a desk that you sit on, and it's so many things that are disheartening that will not encourage you to function well as a teacher. So yes, the issue of finances there has not been a conscious effort from our policymakers, our leaders. It's all been lip service. It's all been political talk. It's all been about trying to win the teachers to their side during elections. And that is why if you do analysis of the various manifestos from both the NDC and the MPP, you will see a list of wonderful promises that have been made to teachers that have never been fulfilled. And of course, next year, another list of promises will come up. So that is the situation that we find ourselves in. We don't think that the leadership of the country in terms of looking at teachers' welfare have been proactive enough. And to even look that further, to think about the situation where it is now assumed that there is a backlog, and because there is a backlog, if teachers are leaving, that shouldn't be a problem. It even makes it worse, because it now tells us that the people who are leading the sector do not care whether the teachers would leave or they will not leave. They do not care whether the teachers will continue to complain about what they need to work or not, because if you complain and you move out of the sector, there is a backlog for them that they can dwell on. And that is the genesis of the problem that we are facing, because they do not see the need to provide the needed kind of things that the people doing teaching need. Because if you complain and you think you cannot endure, leave, because we have a lot of other people who are knocking on the door of the profession and we can let them in. That is problematic. Again, we are the leadership of the country is also looking at teachers shortage in terms of people who are available in the classrooms. And that is why you hear the minister say that we do not have the problem of teacher shortages. But across the globe, we measure teachers. We measure. Hello, can you hear me?
Yes, I can hear you loud and clear.
Can you hear me?
Dr. Anti, I can hear you. Go ahead. All right.
Hello, can you hear me?
Yes, Dr. Anti, go ahead. We can hear you.
Yes, so we measure teachers in respect of the number of students that they are supposed to handle. And we know that our standards is supposed to be one teacher is to 25 to 35 students. So if you have a teacher handling 75 students, you have a teacher handling 80 students, our average as at last year was 1:45 students. It means that you have a teacher shortage, because if you have backlog, then employ them so that we can reduce the teacher to people ratio. You are not employing these people. Teachers are handling as much as 100 students in the class. That has reduced the teacher's ability to study each individual in the class and help them develop individually. And that has also reduced the teacher's ability to use modern pedagogy to be able to deliver the content. These are the challenges that the teachers are facing. So if this is the problem that is at hand, and we hear people managing the sector say that we do not have this problem because there's a backlog or there's a distribution problem, it means that we are nowhere near a proper solution, because they do not understand what is really happening.
Perpetual, what would it take for your people, or what would it take for your people to decide not to leave or to stop them from leaving the country?
Thank you very much. Before I tackle that, let me respond a bit to what Doc said earlier. The bit, you see, I'm a realistic person. When the thing is white, let's say it's white. When it's black, it's black. The truth of the matter is that at the latter part of the NDC regime, we had a huge backlog of our nurses and midwives. When the NPP government came into power, they actually did their best to clear this backlog. We were very happy, and we coordinated it through the Office of the Director HR at the Ministry of Health, and we also worked hand in hand with the Ministry of Finance. And we were hoping to get to a level where as soon as you complete training, you can be absorbed into the system. Unfortunately, it didn't happen because of the fiscal challenges, and we are beginning to see this huge backlog again. So that is to clear the point that it's not been over 7 years, but at least some work was done. And unfortunately, we have gone back to an old system of creating a backlog of professional nurses who need to be employed and are not employed. He also talked about the student allowance. Look, we've been back and forth about this student allowance, and we must understand that nursing and midwifery is such that even when you are a student, because you do clinical attachment, you go to the ward and complement the work of professionals who are working. When you go there, you are a student, but you also aid in the care based on specific, specific training needs or objectives that you need to attain, but at the same time, you're also contributing to the care. And that money is given to support because you are going in, you are taking transportation to the workplace, you are running shift morning, afternoon, evening. You are also buying stuff that you need to take care of yourself in terms of having some gloves in your pocket, some masks that you may need on you because sometimes you don't have enough. And when you are picking, the complaints come in, you are misusing the little bit of resources that we have. So they use it to buy, they use it to also buy gadgets like their spades, their thermometers, and all those things that they need to use when they're taking care of their patients and all of that. So it is important that we see the need of the allowance that is given. But at the same time, we must understand that for us, our vision is to have Ghana as a country align our training to our needs. Currently, what do we need? We are seeing huge numbers of non-communicable diseases. And that should tell us that the renal diseases we are seeing, the high numbers of diabetes, and so on and so forth, requires specialist care or specialized care. Luckily for us, we have the Ghana College of Nurses and Midwives, which is under-resourced and cannot expand to train a lot more of the professionals that we need. They take very limited number every academic year, and the fees is also quite high. Most of our nurses and midwives cannot afford to pay for it. But we must see where the world is going and understand that we need more specialized nurses in terms of the care that we need as a population. And therefore, we need to stop the auxiliary training, focus on the diploma level for a while, and actually move to degree. I would want to even see a decision taken that tomorrow we stop this auxiliary and diploma and move to a degree program. The teaching within the teaching sector, we've seen it. If we need a degree professional to take care of our little ones at all levels, how much more somebody who is going to take care of a complex being? You understand? From your head to your toe, everything about your anatomy and your physiology is complex. And we need people who are highly skilled in terms of their critical thinking, the understanding of issues to be able to take care of us. Let me tell you, some of the deaths that occur are accidental. Maybe we don't probe too much to know and actually hold people for it. But there are certain deaths that could have been prevented if people knew what they were about and were taking the right decisions at the right time, especially in acute care and within emergency situations. So that said, let me say that if we want to address the issue of nurse migration or nurse midwife migration, it's important that first, like I said, let's align our training to our needs, build on the specialty of our nurses and midwives, improve the Ghana College. Let us also understand that we ought to provide decent employment where salaries are good and, of course, allowances that are required to be paid are paid. We have negotiated for collective agreements where Category 2 and 3 allowances are supposed to be paid, such as your additional duty allowance, your transfer grant, and all those things, and they are not being paid. So people work additional hours, and it's ignored. That can never happen abroad. You understand? You clock in your hours, and everybody knows the number of hours. You are paid per hour. If you go to the UK, they are hovering somewhere around 18 or 19 pounds per hour. In the US, close to $40 an hour. So these tend to be very attractive, and you can choose to have flexible hours that you can work, especially looking at the majority of us being females, where you have a little child or you have young children. You don't need to be in the 8 hours. You can choose. You want to do 4 hours, and you are paid for that. And the environment in which we work needs to be improved. The infrastructure, Agenda 1.1 is good, but it needs to come with the requisite accommodation that can accommodate our nurses and midwives and other professionals. Because if you are transferred or you are posted even to a district level or a sub-district level, you realize the kind of poor accommodation that exists there. Road networks are not there, and the social amenities are not there. We need a deliberate effort to improve the economy and make postings to anywhere attractive. We need to also institute the medical insurance that we need. For our association, sometimes we've been accused that we are hindering the institution of a medical insurance within the health sector. But that is not the case. You see, at the end of every month, out of our 18.5% that we contribute to our pensions, 2.5% goes to the National Health Insurance. Why won't we allow the National Health Insurance to have its own money and take care of our health needs? If you don't have a healthy population, how will you be able to achieve whatever your economic targets are? You understand? So the capping, if it needs executive decision by His Excellency, let's remove it. Or if it needs Parliament decision to remove the capping, let's have the National Health Insurance function with the requisite liquidity it needs to take care of our health needs, including the health needs of we, the health workers. Sometimes it's very disheartening to work in a facility, and when you are sick, you need to take money out of your pocket to pay for almost everything that you need.
That's a lot that government has to do to actually stop the attrition. I want to bring in Reverend. What would be satisfactory, in terms of dealing with this matter, as far as the teacher is concerned?
Well, Asha, I think, please, can you hear me?
Yes, go ahead.
Thank you very much. You see, it is only in Ghana that government and its officials feel that they can convince the teachers with sugar-coated words and then the lip services. If government at the end of the day feels that there is no problem, if 10,000 of your teachers are leaving to UK, if government at the end of the day feels that, we don't have teacher shortage problem, but what we have is a teacher deployment challenge, I think we should get worried as a nation. Asha, the people leaving are not just ordinary teachers. They are people who have worked 5, 6, 7, 10 years, some up to 15 years, and they've gotten the experience. And you see, because the president himself told teachers that if you want to succeed, you can't do teaching alone. And the assertion that, teachers, your rewards are in heaven. Now Ghanaian teachers are telling the government and the nation that the reward of the teacher is not in heaven, but rather, if I go to UK, I'll get it. If I go to Canada, I'll get it. And we are also proving that those who are leaving are proving to the president that yes, if you cannot pay me well as a teacher in Ghana, and you are telling me that I cannot be successful in teaching in Ghana, then there is a government somewhere who have made things clear and better for me. Because Aisha, people have worked for 15 to 20 years. They cannot boast of 2-bedroom house. People have worked for 10 years. They cannot boast for just a saloon car to be used for their work. And you have people in other sectors, even their entertainment and bathroom allowance alone can pay about 10 teachers their monthly salary. And all of them admit. Last week, I was on Newsfile with Honorable Apak, and he admitted that to him, if there should be any profession to be paid higher, it should be teachers and not politicians. And the communication director for MPP referred him that, look, then you are a parliamentarian. What law are you passing to make sure that teachers are well motivated? Since 2009, Aisha, government was supposed to pay 20% allowance to teachers who are self-posting in the rural areas. Since 2009 till date. From 2009, GES complained that they cannot identify rural areas in this country. And in 2020, in the new collective agreement, there was a clause that there should be a committee to go around the country to identify rural areas. From 2020 to date, our collective agreement expired this year, August. And I want to advise the government that once we are in the process of renegotiation, government should take keen interest in the new agreement to make sure that teachers get what they want. Because I told President last week, Thursday, that if you want Ghanaian teachers to stay, it is not about big English. It is not about big promise. Give the teachers money. The teachers should be able to feel comfortable that I've worked for 5 years. I can at least point to my 2-bedroom house. The teacher have worked for 10 years. I can at least point to my vehicle, my own personal vehicle. There are no provisions for the teachers. And so sometimes when we hear people in authority saying that we don't have any problem, we already have a number of teachers standing by. If people go through distance program, they go through training, a college of education, and you have not recruited them, you call them teachers? If you have not recruited them, you don't call them teachers. Until you recruit them, you can't add them to the teachers in the service. So I think for us, what the government should do, this time around, we are tired of the lip service and then the sugar-coated words and this big English in the manifesto.
I'm happy that you talk about manifestos. And Dr. Said Sapon, next year is an election year. It is obvious government will attempt to fix a number of these problems, at least to win votes. If we ever get lucky for this attrition to get to the attention of government, what would you want to see?
Interesting. I have said that the biggest vote cow when it comes to elections is health and education in our country. And that's why you see one government saying SHS should be 4 years and another one saying 3 years. That's why you see the tough war around nursing allowances and all that. And I think my issue about nursing allowance is not about its payment or its merit. It is about our inability to leverage it once we've paid it. So if you look at it, and I listened to the president of the nurses very well, if you look at it and you say, we started doing some work in 2017. Unfortunately, the work we did is all been eroded, and now we're back at 2017 levels because we couldn't sustain it. It goes back to what I said earlier. We are not being purposeful and intentional. We are not carrying these processes through. You listen to the teachers, the same thing is playing through. So if you ask me the question as to what I want to see in 2024, the answer is our solution doesn't lie in a manifesto, either from the NDC or from the NDP, because those are ad hoc measures. Anyone who's worked in health or has been a reader in health policy will tell you that health outcomes are never achieved over a 4-year cycle. Short term in healthcare is 5 to 7 years. Everyone knows. Medium term is 7 to 10 years. Long term is 10 to 20 years. So if anyone comes to you with a manifesto saying that I'm going to achieve a particular health outcome in 4 years, the person is lying to you through their teeth. That is why when it comes to universal health coverage, even though it was signed in 2015, the whole world was going into 2030. That is why when you looked at the Millennium Goals, it had a medium-term direction. So I'm not looking at 2024. Anyone who comes to me in 2024 to come and promise anything basically is lying to us. And I don't say this ordinarily. I say this based on all the evidence. What we need to do is to have a national agenda, purposefully, to address these solutions. And why do I say that? This mass migration in 2000, when Kufuor came to power, was going on. He tried to solve it by bringing in things like giving health workers incentives like cars and all those things, and that led to the setting up of the Ghana College of Nursing, the Pharmacy College, the Physicians College, and all that. It stemmed it a bit. Now we've gone back. We need to have a clear plan. And so for me, 2024 doesn't come.
We need to have a clear plan.
Move.
It shouldn't be in a manifesto. It must be a national agenda. I would have loved to continue with this conversation, but of course, I think that we've made the point. There must be a clear national agenda to deal with this situation. Thank you so much. I'm grateful, gentlemen and lady, for your time. My name is Aisha Ibrahim. Do enjoy the rest of our programs.